So thanks so much for joining us. Today I'm going to be speaking to Ruth Sutherland. She is an antenatal educator and a specialist in baby massage. Now, I actually had Ruth as my antenatal educator for my MCT class while I was pregnant with Ava, and we all absolutely loved her. So she's been kind enough to agree to chat with me today and to answer some of those questions which we all have when we're pregnant and when we've got a new young baby. So thank you so much for joining us today, Ruth.
Having me.
Really appreciate it. So if you want to just do a minute or two just on who you are and your specialities, and then I'll get into some of the questions.
Yeah, I'm Ruth Sutherland, and I've been an antenatal teacher for about 7.5, 8 years.
Really?
And I've been doing baby massage for about 3.5 years.
Lovely, isn't it?
And it's just so lovely, and both are things that I didn't do myself as a new mum.
Yeah.
And so I feel even more passionate about doing them because
Yeah.
I know that the effects, that they can have and how wonderful they can be. So,
Yeah, I mean, I did Ruth's baby massage class as well, and it was a course actually. How many are there in the course?
There's usually four
Four
sessions for a group.
Yeah.
And there's usually between 3 and 8 mums or dads and babies per group.
Oh, it's so lovely, and the babies just adore it, don't they?
They love it, yeah.
They do.
They love it.
It's wonderful. Okay, right. My first question for you, Ruth, is what types of pain relief are available for labour?
Well, they usually start you off with paracetamol. If you make a phone call to the hospital, it's the first sort of thing that they would offer you.
Yeah.
And then you could go on to have sort of the gentle sort of type, such as your TENS machines. You can use water, and that could be just having a bath or shower or using a birth pool.
Yeah.
You could use hypnobirthing techniques. You don't have to go to a set class if you don't want to. You can download apps and use books if that's your sort of thing. They're online, which are very good. And that would just help you with your breathing and help you to stay grounded and less fearful, really. And then there's Entonox, otherwise known as gas and air.
Yeah.
And then there's the stronger things such as diamorphine and pethidine and epidurals as well.
Yeah. And tell us a little bit about like pethidine. That's one of the ones that does go through to the baby.
It does,
Can anaesthetise the baby a little bit?
It can. It's administered by injection, usually into the bottom or thigh, and it makes you very, very, very sleepy, very drowsy.
Yeah.
And if you're dilating very slowly, then that can be quite helpful. So if you have it early on, then it can have a nice sleepy effect, and it doesn't necessarily harm the baby because your baby, by the time your baby's born, it's gone out of your system.
Now, I actually did have this.
Yeah.
I was in labour for 40 hours, and I was, every time I went to the birthing unit, I was dilated 1 centimetre, 2 centimetres, and I was like, oh my goodness, how am I going to, I just don't know how I'm going to do this.
Yeah.
And then when I got to, I think it's 4 centimetres, and they'll let you stay, they don't send you home anymore, 5 centimetres maybe. And then I spent 5 hours jumping up and down on a birthing ball trying to get my waters to break, and they wouldn't break. And my husband said to me, I think you need to take something because you're going to be here hours and you're going to be so exhausted, because I couldn't sit down or lie down because my contractions would start going backwards.
Yeah.
So I was squatting and lunging, and luckily I do a lot of exercise, so I was okay doing that for hours and hours on end. But I got to a stage where I was like, I don't know what to do. My waters aren't breaking. I'm not progressing in my labour at all. And they said, look, if you want to stay in the birthing unit, I think we're going to have to give you some pethidine, and that's one of the only ones, obviously gas and air, but that's one of the only ones that they can give you, and you stay in the birthing unit. And they said, look, we're going to give you soap, because I was like, no, it's going to go through to my baby. And they said, look, we're going to give you such a little amount, it will not go through to your baby, you're still a long way away, it will be out of your system. And they gave it to me. I lay down on the floor, my waters broke, I was progressing through the labour, got up, went into the birthing pool and had baby.
And sometimes that's all that women need. They just need to rest and relax, and the body will do what it needs to do. But it's funny though, because it's
almost like I certainly felt, oh my God, I'm failing if I take anything. There's, I've not achieved what I wanted to achieve, this natural labour if I take anything. Actually, it was the best thing I could have done for my particular journey.
And I think with diamorphine or pethidine, it's, if you have it early on, that's the ideal effect. So you're an ideal candidate to have that. If you were to have it sort of much later on in labour, then that's where the risk factors increase with baby, really, because what you want is a baby it's come through your system and it's cleared through the baby's system, and so they come out as if they hadn't had it in the first place. That's what we want, really.
Okay, well, that's really good. And what are the natural forms of pain relief for labour? You mentioned water, which I know is really good for lots of people.
Yeah, the natural forms would be the breathing all the way through labour. It's a really powerful tool for us to use. And again, the hypnobirthing and the water and the TENS machine. So those are your most natural ones.
Yeah. And what is the TENS machine exactly?
It stands for transcutaneous electrical nerve stimulation.
Okay, it rolls off the tongue.
Not really. And how it works is it supplies very tiny amounts of electricity, so it's not suitable for people with heart conditions or people that have seizures, perhaps, not without seeking, sort of medical advice first. Yeah. And because it's mild electrical currents, it shouldn't be used in the bath or in a birth pool. Yes. But other than that, it's generally very, very safe to use.
So I'm imagining, those they used to do adverts for it, and sort of people would be sitting on a couch, and it would be like a type of exercise. Very similar,
very similar, very similar, and it doesn't vibrate and move like that. Yeah. But if you were to put it on your back, it usually works in 4 pads that go either side of the spine. And what you feel is like a very gentle humming or buzzing. Okay. So very small vibrations that you feel. No, no. What is important is that the wearer has the control panel. Yeah. Because your sensations adjust and you can turn it up or down accordingly. Yeah. If a partner has it, you might not feel anything for a minute or two, and then it might be turned up, and then you might go, oh, that's a bit much. So always be the one that actually has, definitely.
That's a motto for life, isn't it? Okay, brilliant. So now, what is the bloody show? Now, this is just the worst name I can possibly think of. I don't know who came up with it.
It's not swearing.
It's not
It's
swearing.
The mucus plug that comes away when the cervix is changing. Yeah. And the cervix needs to change and ripen so that a woman can dilate. Okay. And so when that softening takes place, then a heavy discharge comes away. Okay. So it's a jelly-like plug, really.
And I didn't get one. Not that I noticed.
Okay, some women will definitely know when they've got it. It comes out in a big glob, if you like. And other women, it will come away really, really slowly and gently. So you may have had a slightly heavier discharge than usual, but just not really recognised that. Yeah.
But it can be, it can be quite interesting, can't it? I know a friend of mine said that her husband actually thought that she was giving birth to the baby. Yeah. It was a lot.
I don't think I didn't have one. Yeah. Not that I remember, but a lot of women will pull, a bit of a mess. Yeah.
Yeah. So, and bloody show is actually probably quite
it shouldn't
the right term for it.
It shouldn't be full of blood. It shouldn't be bloody. Yeah. There shouldn't be fresh blood coming away from us in our pregnancies. But a bit of spotting, a little bit of streaking in that is relatively normal. But if you were worried about having a show, then obviously you'd seek advice.
Yes. Okay. So I think we've covered what does a bloody show look like. It is a mucus plug with some sort of brownish
it's heavy mucus,
spotting in it.
Yes, yeah.
Lovely.